Welcome back. Chances are you know someone who's frozen their eggs. Maybe you have, or your daughter or sister. At the very least, you've likely at least heard of the procedure aimed at preserving fertility for women typically in their 20s or 30s. More than 12,000 women go through the process each year, and even more families rely on the process of in vitro fertilization, which includes the hormone treatment to retrieve eggs. But what exactly does the process entail? How tough is it on the body? Well, I can now speak from personal experience.
Just over a year after our wedding, my husband Alex and I are starting a journey familiar to many families. Over the course of 9 days, I did 22 shots at home.
Good job.
And at work.
Running off set to do this shot while we're in the middle of breaking news.
All to prep for an egg retrieval. But why worry about my fertility? I'm 32 years old and happily married. Well, you can learn a lot about your reproductive health from some simple testing any woman can ask for, a blood draw and an ultrasound. I met with Dr. Sekhon of RMA of New York for my initial fertility consultation.
Okay, so this is your right ovary.
We got some good news about how many eggs could potentially be retrieved.
So there's about 16 on this ovary, which is a really high number. That's great.
But also a red flag.
What you can see, it looks like you would potentially diagnose with PCOS.
Yeah, it's based on 2 out of 3 of the following: having slightly irregular cycles, having polycystic appearing ovaries. So 2 out of 3 are already
check, check.
Polycystic ovarian syndrome is a hormonal imbalance in the ovaries that can cause a wide range of symptoms, from irregular menstrual cycles to migraines to fertility issues. An estimated 5 million women in the U.S. have the condition, often difficult to definitively diagnose.
There's a real reason why this could make a real difference in our chance at having a family down the road.
Another factor to weigh when family planning, freezing eggs versus freezing embryos, a decision for my husband Alex and I that initially surprised us.
Wow, I guess that's an option for me, and we should talk about it. What are the pros, what are the cons?
Freezing embryos involves the same process as egg freezing, taking hormone shots to stimulate egg growth and then retrieving them. But then those eggs are fertilized with sperm.
The downside of egg freezing is you don't ultimately know how many of these eggs will thaw, fertilize successfully, and actually make it to the embryo stage. And only 60% of fertilized eggs are capable of turning into embryos. Embryos have so many cells that their thaw survival rate tends to be higher, around 98%.
With my new diagnosis, we decided embryos was the right path for us.
Just learning more about it, we got more comfortable and it made more sense for us.
My regimen started with 2 shots a day.
Good job.
Mixed at home and a blood draw and ultrasound every other day. Soon, it up to 3 shots a day with monitoring every day.
These are them growing, getting bigger.
As the days wore on,
Every step is straight to the ovaries. And bumping around on the subway train. Whew.
the side effects, made more severe by my PCOS, became quite apparent.
It is just a bloat that won't go away. There's some cute little bruises.
So when I got the news,
It's time for the retrieval in 2 days from now.
I was thrilled.
Thank you so much.
11 days after that first hormone shot, it was time for the retrieval, a minimally invasive procedure that uses an ultrasound to guide a needle to the ovaries. A suction device on the needle pulls out the mature eggs.
Your procedure itself is 15-20 minutes.
Okay.
Recovery is 45.
I said goodbye to my husband,
Good luck with your very easy portion of this.
suited up,
Follow me in here, please.
and we were ready to roll.
It was a really straightforward procedure. It was really easy to access both ovaries.
Okay. I'm honestly pretty uncomfortable.
Let's get you home. I'm very proud of Savannah. In marriage, like, you're obviously thinking and doing things for your spouse, right? But this is kind of the first time we've both, more Savannah than me, had to do something for potentially a new family member.
I feel really happy and proud of myself and proud of us, and just like it was totally worth it. Very proud of my husband also for going on television to talk about all this. So we have Dr. Sekhon in studio with us today to talk more about this process. She is a double board certified OBGYN at RMA of New York Fertility Clinic, and of course, my doctor as well. Dr. Sekhon, thank you for coming in.
Thank you for having me.
Appreciate it so much. It's so great to have you. Let's talk about the attrition rate, because where we kind of ended in this process is very happy, very hopeful about our situation, but we were a little surprised. I mean, that drop-off rate from eggs to healthy embryos was over 60% for us, which I know is kind of fairly normal. Families go through a lot in this.
Yes, I think a lot of people don't realize how inefficient human reproduction is. And so there can be a lot of confusion, especially when you think about egg freezing and expectations about the fact that one egg does not make one baby. Not every egg is going to survive the thaw if you're starting with frozen eggs. The majority will, but you're going to lose some at that stage. Not every egg will fertilize. It's typically 70 to 80%. And of those that fertilize successfully, about 60% typically make it to the embryo stage. And no one makes perfect embryos 100% of the time. Even in your 20s, 20 to 25% of embryos may have genetic imbalances that prevent it from becoming a healthy pregnancy. So you have to really counsel patients appropriately so that they understand and have realistic expectations about how many eggs they're starting with and what that might mean down the line.
We should talk about what's been in the news lately. The freezing embryos and eggs, the process has come under threat. Talk about why this is so important for families that are looking to grow their family.
Right. So when you freeze eggs, you're freezing potential. But when you're actually trying to help a patient get pregnant with IVF, you need to turn those eggs into embryos. And the reason this has come under threat is this idea of personhood, assigning a personhood to embryos, and not realizing that even when you get to the embryo stage, not every embryo is healthy. And even the healthy ones that are tested, because you can do genetic testing on embryos, not every single one of those will implant. So when I counseled you about where we landed and the number of embryos you got, even then I said, okay, based on how they look under the microscope and the test results, you know, they might have about a 60 to 70% chance each of actually implanting.
Yeah, and you knew that was a big conversation for me. I mean, it took me a while to make that decision as a person of faith, seeing a person who's very much in the news and seeing all that conversation, but you did counsel me so well. We only have like 30 seconds, but let's just touch on the PCOS of it and
Right.
treatment options. You've been helping me through that.
Yes, so PCOS is extremely common. It affects about 10% of the population, and it's a condition that can predispose you to having irregular ovulation. And a lot of people aren't aware of the fact that they only ovulate one egg every cycle, and if you never know when that's going to happen, it can be really hard to time your attempt, and it can make trying to get pregnant even less efficient than it already is. So anytime someone has any sort of gynecologic issue that could predispose them to infertility, doing something like this as a backup plan in case you should ever need fertility treatment to build your family, it just gives you a really great head start and ensures that you will be successful.
Yeah, the way you kind of helped me understand it was I most likely have less chances to get pregnant a year. We don't know when those chances are, and we don't exactly know how many, which just makes it all tough. As you said, inefficient.
Exactly.
Dr. Sekhon, thank you for coming on today, and thank you for treating me. It's been such a joy getting to spend so much time with you.
Thank you so much, Savannah.
And clearly a conversation that so many families are having right now. So glad we could have it here. That's going to do it for this hour.